68-year-old male presents with left-sided weakness and numbness of 1 hour duration. What is the first thing you would do? A. Start N4 for TPA infusion. B. Draw blood for a chemistry profile, CBC, and clotting factors. C. Notify neurology about a possible stroke admission. D. Get a complete history from the patient regarding past medical history. Answer: A stroke is a medical emergency for which TPA, tissue plasminogen activator, infusion is the proper treatment if given within 4 to 6 hours of onset of symptoms. If time permits, a CT scan can be ordered to verify that the patient has had an ischemic and not a hemorrhagic stroke. The sooner the TPA is given, the better is the recovery from the stroke symptoms. To select the possible triggers for an asthma attack, please select all that apply. A. Warm air. B. Cold air. C. Animal dander. D. Pollen. E. Inhaled corticosteroids. Answer: S. B. C. Dare correct. Pollen, exercise, cold air, and animal dander can all trigger asthma attacks. Inhaled corticosteroids are a preventative measure against asthma attacks, and warm air does not usually trigger asthma attacks. 3. A patient with nonspecific chest pains is placed on a cardiac monitor. An alarm indicates the patient is in asystole and you are the first person to arrive into the patient's room. What is the first thing you should do? A. Start cardiac compressions. B. Deliver 5 quick breaths. C. Determine that the patient is unconscious. D. Call a code blue. Answer: C. There are many reasons why the alarm could have gone off, including disconnection of the machine from the patient. You need to first determine that the patient is unconscious before calling a code blue and beginning BLS and ACLS maneuvers. For a motor vehicle accident, patient arrives at the ED and is in need of airway management. He is wearing a cervical collar, C collar. What is the appropriate way to establish an airway? A. Remove the C collar and perform a head tilt maneuver. B. Keep the C collar on and perform a jaw thrust maneuver. C. Immediately intubate the patient. D. Get out the AMBU bag and apply to the patient's face. Answer: B. Given that the patient was in a motor vehicle accident and has not yet been cleared as to the status of his cervical spine, the first thing you would do is perform the jaw thrust maneuver with the C collar on to see if this opens the airway. Removing the C collar might only do further damage to a compromised cervical spine. Intubating or using the AMBU bag are things you would do once you determined that the patient did not have spontaneous respirations after opening the airway using the jaw thrust maneuver. 5. A patient has the automatic external defibrillator, AED, applied and the defibrillator is indicating a non-shockable rhythm. What is the next step? A. Override the AED and shock the patient. B. Check the leads on the AED. C. Resume CPR and recheck rhythm in 2 minutes. D. Turn off the AED and restart it. Answer: C. If the AED is indicating a non-shockable rhythm, resume manual CPR and recheck the rhythm in 2 minutes. Turning off the AED and restarting it would only delay CPR and it is not possible to override the AED. The leads would automatically be on the patient for the AED to give the diagnosis of a non-shockable rhythm. 6. A 26-year-old female presents with abnormal vaginal bleeding, severe left-sided pelvic pain, and hypotension. Which of the following tests and interventions would you do? Select all that apply. A. Start N4. B. Obtain a urinalysis. C. Check a serum pregnancy test. D. Order a stat ultrasound of the pelvis. E. Order a CT scan of the pelvis. Answer: S. A, C, D are correct. This is a medical emergency and the patient likely has a ruptured ectopic pregnancy. A CT scan of the chest might take too long and a bedside ultrasound could clinch the diagnosis much faster. A urinalysis would not be helpful in this situation. 7. Which of the following is part of the guidelines for CPR by a health professional? A. Give 2 breaths for every 15 compressions. B. Each breath should be given over 1 second, watching for the chest to rise with each breath. C. Deliver 2 quick chest compressions and then check the airway. D. Deliver 1 breath for every 5 compressions. Answer: B. You should have each breath given over 1 second, watching for the chest to rise with each breath at a ratio of 2 breaths for every 30 compressions. You do not give 2 quick chest compressions before assessing the airway. 8. For a child the age of 8 who requires CPR, the nurse should give 1 breath for every chest compressions. A10 to 12 15 to 16.6-8D. 5. Answer: C. For a child, the proper ratio of breaths to compressions is 1 to every 6 to 8 compressions. 9. An unconscious patient has a fine irregular pattern on the cardiac monitor. Which should be the next step? A. Put a nitroglycerin tablet under the patient's tongue. B. Start CPR. C. Take the patient's blood pressure. D. Check the leads on the cardiac monitor. Answer: C. The patient has a rhythm suggestive of ventricular fibrillation. As he is unconscious, it is unlikely that the monitor is showing artifact. Taking the patient's blood pressure and using nitroglycerin under the tongue would only waste valuable time. 10. A child has a 2 cm dirty laceration on his forehead. What is the first nursing technique to use? A. Papoose the child and clean out the wound with saline-soaked gauze. B. Call the doctor to suture the laceration. C. Get out the staple gun to apply staples. D. Apply EMLA before cleansing the wound with saline-soaked gauze. Answer: D. The application of EMLA will numb the wound so that cleaning with saline-soaked gauze will be less painful. The papoose may be unnecessary if the child has minimal pain with cleansing. Forehead lacerations are rarely sutured with staples and the doctor cannot suture a wound until the nurse has cleansed the wound of dirt. 11. A 17-year-old patient presents to the ED with signs and symptoms of bacterial meningitis. What things are appropriate nursing interventions? Check all that apply. A. Initiate anti-seizure precautions. B. Start N4 at 300 cubic centimeters per hour. C. Monitor for increased intracranial pressure. D. Monitor vital signs. E. Monitor neurological signs. Answer: S. A, C, D, E are correct. The suspected bacterial meningitis patient may have seizures, so you need to start anti-seizure precautions, monitor for ICP, and monitor for vital and neurological signs. Starting N4 at such a high rate only increases the chance for increased intracranial pressure. 12. When testing the motor responsiveness in an unconscious patient, one should do the following maneuver. A. Press on the upper orbital ridge. B. Do a sternal rub. C. Put pressure on the nail bed. D. Squeeze the gastrocnemius muscle. Answer: C. To check for motor responsiveness in an unconscious patient, you must apply direct pressure with your nail to the nail bed of the unconscious patient. The other maneuvers are tests of the cerebral response to pain rather than a peripheral response, motor response. 13. A patient has come to the ED following a seizure. Which of the following nursing interventions should be undertaken? Check all that apply. A. Set the bed to the highest position. B. Have airway equipment standing by. C. Start N4. D. Pad the sides of the gurney. E. Place a tongue blade at the table at the head of the bed. Answer: S, B, C, D are correct. The bed should be set to the lowest position and N4 should be started. In case 4 medications are required if the patient has a second seizure. The bed should be padded as part of seizure precautions. The use of a tongue blade during a seizure carries many complications, including airway obstruction and tooth breakage. 14. A patient presents to the ED with signs and symptoms of Guillain-Barré syndrome. His past medical history likely consists of the following: A. Respiratory or GL infection within the 1 to 4 weeks. B. History of head trauma within the last 6 weeks. C. Meningitis within the past year. D. History of a seizure disorder. Answer: A. Guillain-Barré syndrome is a post-infectious disorder usually with a history of a respiratory or GI infection within the past month. Head trauma, meningitis, and seizure disorders do not normally lead to a subsequent diagnosis of Guillain-Barré syndrome. 15. The ED physician orders irrigation of the ear in the ED. What should the nurse do? A. Have the affected ear face up following the irrigation with the patient on his or her side. B. Direct the stream to the wall of the ear canal. C. Use hot saline for the flush. D. Have the affected ear face up during the procedure with the patient lying on his or her side. Answer: B. In ear irrigation, the patient should be sitting up with the ear tilted downward to allow for drainage of the ear. The solution used for irrigation should be at body temperature to avoid symptoms of nausea and vertigo. The stream should be directed to the wall of the ear canal and not directly at the eardrum. 16. The ED physician orders mannitol for the treatment of increased intracranial pressure in a trauma patient. What is true of mannitol for this purpose? A. Mannitol is given intramuscularly. B. Mannitol is an osmotic diuretic. C. Side effects of mannitol include tremors and increased intraocular pressure. D. Mannitol does not cause electrolyte imbalances. Answer: B. Mannitol is an osmotic diuretic used to treat increased intracranial pressure. It is given by 4 infusion and has side effects of headache, nausea, vomiting, electrolyte imbalances, and disorientation. It decreases intraocular pressure as well. 17. A patient from an automobile accident is on a backboard with a C-collar and begins to vomit. What are the next appropriate steps? Check all that apply. A. Remove C-collar to allow patient to vomit with head turned. B. Suction the patient if necessary. C. Turn the backboard and patient to the side while vomiting. D. Quickly undo the backboard only and get the patient on his or her side. E. Remove both the C-collar and backboard so the patient can sit up or turn to side to vomit. Answer: S, B, C are correct. The patient must have the C-collar on and the backboard until he or she is cleared for fractures of the spine. If the patient is vomiting, flip the entire patient and backboard to the side in order to vomit and suction the patient's mouth if needed. 18. An ED patient is suspected of having glaucoma. The nurse recognizes that the normal range for intraocular pressure using tonometry is 2 to 5, 6 to 10, 10 to 21 D 25 to 40. Answer: C. The normal range for intraocular pressure as examined by tonometry is 10 to 21 mm Hg. 19. 4 patients arrived to the ED from the same automobile accident. In what order should patients be attended to? A. 6-year-old patient with multiple facial lacerations. B. A 65-year-old patient with a broken hip. C. A 25-year-old patient with a blood pressure of 75/30. D. A 35-year-old with chest pain and bruising to the chest from the airbag. Answer: C, D, B. A. The patient with hypotension needs immediate attention and the patient with chest pain may have a cardiac contusion from chest trauma. The 65-year-old patient needs an 4 in case of hypotension and the person with the facial lacerations needs suturing but this can wait. 20. A patient arrives at the ED with a lie burn to both eyes. No previous first aid has been given. What is the logical next step? A. Irrigate the eyes with normal saline until pH papers return with a normal pH. B. Call poison control for advice. C. Irrigate the eyes with dilute acetic acid. D. Irrigate the eyes with dilute HCl. Answer: A. Regardless of the chemical in the eyes should be flushed with normal saline. If the irritant is acidic or basic, you can continue to irrigate the eyes until pH papers placed on the conjunctiva are normal. Do not attempt to use an acidic antidote. The call to the poison control center would take away valuable time that could be used for irrigation. 21. A patient presents to the ED with a wood splinter penetrating the cornea. The initial step the nurse must do is the following. A. Remove the splinter with a sterile forceps. B. Cover the eye with an eye patch. C. Irrigate the eye with sterile saline. D. Check visual acuity. Answer: C. The eye should be irrigated with sterile saline to remove any debris. The splinter may be holding together important eye structures and should only be removed by a trained specialist. Visual acuity is not important at this stage, and an eye patch may further dislodge the foreign body and should not be attempted. 22. A patient has been struck in the eye with a baseball bat. What is the initial recommended treatment? A. Irrigate the eye with normal saline. B. Check a visual acuity. C. Apply warm compresses to the eye. D. Apply ice to the affected eye. Answer: D. Ice should be applied to the eye as soon as possible. A visual acuity is not an initial recommendation, and normal saline will not help the eye. Warm compresses will only worsen the amount of swelling and bleeding the patient will have. 23. A patient arrives to the ED with a buzzing insect lodged in his ear. What is the first step in the management of this condition? A. Kill the insect with alcohol or mineral oil in the external ear canal. B. Pluck out the insect. C. Assess hearing in the affected ear. D. Irrigate the ear with normal saline. Answer: A. The insect should initially be killed with alcohol or mineral oil before removing it with a forceps or irrigating the ear. A hearing assessment is not necessary unless the patient reports decreased hearing after the insect is removed. 24. A patient presents to the ED with pain, redness, and swelling behind one ear. Other signs and symptoms a nurse would look out for include the following. List all possibilities. A. Earlobe swelling. B. Coolness to the skin upon touching it. C. Low-grade fever. D. Ear drainage. E. Vertigo. Answer: S. A. C. D. The patient likely has mastoiditis, an infection of the mastoid sinus. Symptoms can include earlobe swelling, low-grade fever, drainage from the ear, and irritability or lethargy. Vertigo is not a symptom of mastoiditis, and the skin overlying the mastoid sinus is likely to be warm. 25. A patient with a bladder infection is being discharged on Bactrim orally. What should the nurse instruct the patient to do? List all possibilities. A. Limit intake of liquids. B. Be aware of the possibility of a rash from Bactrim. C. Avoid bathing. D. Increase intake of fluids. Answer: S. B. D. The patient with a UTI should increase fluid intake and be on alert for a sulfur rash, which is relatively common. Bathing can be as before the UTI. 26. A patient from a motor vehicle accident is suspected to have bladder trauma because of pain radiating from the lower abdomen to what other place? A. Shoulder. Hip. C. Umbilicus. D. Both knees. Answer: A. Pain from bladder trauma radiates to either shoulder due to irritation of the phrenic nerve. Bladder pain does not radiate normally to the hip, umbilicus, or knees. 27. A patient presents to the ED with left flank pain, fever, and dysuria. The nurse should anticipate the following: check all that apply. A. The possibility of hypotension. B. Hematuria. C. Ectopic pregnancy. D. Renal cancer. E. Pyelonephritis. Answer: S. A. B. E. The patient probably has pyelonephritis associated with flank pain, dysuria, fever, hematuria, and the risk for urosepsis with hypotension. Renal cancer and ectopic pregnancy do not present with these symptoms. 28. A male patient has fallen from his horse. While putting in a urethral catheter, you notice blood at the urethral meatus. What is the next step? A. Use a small bore catheter. B. Obtain a urinalysis. C. Give pain medication prior to inserting the catheter. D. Notify the ED physician. Answer: D. The trauma patient could have severe pelvic trauma and transection of the urethra. Notify the ED physician, who will ascertain the source of the bleeding before any catheter can be inserted. The other answers are incorrect. 29. An injured patient has suffered an acute renal injury. The electrolytes return with a potassium level of 6.1 milliequivalent/L. What is the nurse's next clinical step? A. Obtain a urine potassium level. B. Obtain a serum sodium level. C. Place the patient on a cardiac monitor. D. Obtain a complete urinalysis. Answer: C. The patient with hyperkalemia is at risk for cardiac arrhythmias and should be placed on a cardiac monitor before checking any of the other parameters. 30. Acute bladder trauma can show the following signs and symptoms. Check all that pply. A. Anuria. B. Nausea and vomiting. Hematuria. D. Dysuria. E. Low abdominal pain radiating to the shoulders. Answer: S. A, B, C, E. A patient with bladder trauma presents with anuria, nausea and vomiting, low abdominal pain radiating to the shoulders and hematuria. They generally do not have dysuria. 31. A male patient presents with acute epididymitis. He is expected to have all but which of the following symptoms? A. Scrotal pain. B. Testicular torsion. C. Scrotum swelling. D. Bacteria in urine. E. Fever and chills. Answer: B. A patient with acute epididymitis is expected to have all of the above symptoms with the exception of testicular torsion. 32. A patient presents to the ED with flank pain and shortly thereafter passes a calcium-based kidney stone. What should you tell the patient to avoid eating upon discharge? Check all that apply. A. Meat. B. Liver. C. Milk products. D. Beans. E. Fine boned fish. Answer: S. C, D, E. A patient with a calcium-based kidney stone should avoid eating milk products, beans, fine boned fish and chocolate. Liver and meat can be eaten. 33. Post-ed instructions for preventing recurrences of cystitis include: A. Void every 8 hours. B. Good perineal care, wiping from front to back. C. If pregnant, void every 6 hours. D. Increase sexual activity. Answer: B. Post-ed instructions to avoid recurrent cystitis include voiding every 2 to 3 hours, good perineal care, and decreasing sexual activity. They should avoid tub baths, bubble baths, and sitting in a wet bathing suit for prolonged periods of time. 34. Signs and symptoms of hypovolemia include all but the following: A. Tachycardia. B. Increased urinary output. Attention. D. Decreased fluid intake. Answer: B. Signs and symptoms of hypovolemia are decreased intake and urinary output. Hypotension and tachycardia. 35. EKG signs of hyperkalemia include: list all that are true. A. Peaked P waves. B. Widened QRSC peaked T waves. D. Shortened PR interval. Art block. Answer: S. B, C, E. EKG signs of hyperkalemia include flat P waves, widened QRS, peaked T waves, prolonged PR interval, heart block, ventricular fibrillation, and asystole. 36. A patient is to receive TPA for a diagnosis of acute pulmonary embolism. What medical condition should be reported to the ED physician? A. A BP of 180/110. B. Adventitious breath sounds. C. Respiratory rate of 25. D. Oral temperature of 99.5 degrees Fahrenheit. Answer: A. TPA use should be avoided in cases of uncontrolled hypertension due to the risk of cerebral hemorrhage. The other findings do not limit the giving of tissue plasminogen activator. 37. A patient is receiving Activase, ALTE place. He suddenly complains of itching and shortness of breath. What should the nurse do? A. Cut back on the infusion rate by half. B. Give Benadryl and continue the infusion. C. Give Vistaril and continue the infusion. D. Stop infusion and notify the ED physician. Answer: D. The patient is clearly having an anaphylactic reaction to ALTE place which needs to be discontinued with notification to the doctor. 38. The patient is placed on heparin drip. What should be considered if excessive bleeding? Per rectum is noted. A. Administer vitamin K and stop infusion. B. Continue infusion and give vitamin K. C. Administer protamine and stop infusion. D. Administer aminocaproic acid. Answer: C. Protamine is the antidote for heparin and should be administered along with stopping the infusion. Aminocaproic acid is an antidote for thrombolytic therapy and vitamin K is the antidote for warfarin, Coumadin. 39. A patient presents to the ED in acute pulmonary edema. What should the expected results be from an 4 dose of bumetanide? Check all that apply. A. Decreased urinary output. B. Decreased crackles in the lungs. C. Increased urinary output. D. Frothy pink sputum. E. Increased tachycardia. Answer, SB. C. Bumetanide is a diuretic that should decrease the amount of frothy pink sputum, increase urinary output, decrease crackles in the lungs and decrease tachycardia. 40. A patient is on a heparin drip following a stroke and the ED physician starts her on warfarin. What can you tell the patient about warfarin? A. That the heparin will now be discontinued. B. That the warfarin is indicated for the acute treatment of stroke. C. That the patient will need to be on a heparin drip until the INR reaches 2 to 3 in a few days. D. That the warfarin acts the same way as the heparin. Answer, C. Warfarin can thin the blood once the INR has reached 2 to 3. In the meantime, the heparin drip is usually continued. Warfarin does not act in the same way as heparin and is not indicated for acute stroke. 41. A hypertensive patient presents to the ED with wheezing and bronchospasm. He was just placed on antihypertensive medication. What medication was most likely started? A. Nifedipine. B. Hydrochlorothiazide. C. Propranolol. D. Guanfacine. Answer, C. Propranolol is a beta blocker which has, as a common side effect, bronchospasm. This symptom is not seen when starting the other medications. 42. A patient on Naloxone returns with a digoxin level of 1.2. What can you tell the patient? A. That he is at risk for hypokalemia. B. That his digoxin level is normal. C. That his digoxin level is too low. D. That he is at risk for hyperkalemia. Answer, B. A normal digoxin level is 0.5 to 2.0. The patient is not at risk for high or low potassium while on Naloxone, but hypokalemia can worsen digoxin toxicity. 43. A patient is on TPA following an acute myocardial infarction. What is the most important thing to be monitoring? A. The protime. B. Bleeding. C. The INR. D. The urine output. Answer, B. While on tissue plasminogen activator, the patient should be monitored for any type of bleeding. The protime, INR, and urine output are not measures of TPA efficacy or toxicity. 44. A patient is on procainamide in order to treat a cardiac dysrhythmia. He complains of being dizzy. What is the first thing the nurse should do? A. Obtain vital signs. B. Obtain a stat EKG. C. Measure heart rate on cardiac monitor. D. Assess the monitor for prolonged QT. Answer, A. Procainamide can cause abnormalities in the vital signs and dizziness. This is the first thing you should assess the patient for. The other things are secondary to obtaining the vital signs. 45. A patient on a heparin drip is felt to be in therapeutic range when which of the following are noted? A. An APTT of 120 or greater. B. A PT of 23. C. An APTT of 28. D. An APTT of 60. Answer, D. The PT is a measure of Coumadin therapeutic range and an APTT level of 28 indicates the heparin is not therapeutic. An APTT of 120 or higher is too high. 46. The main cardiac stimulator used in a cardiac arrest is what drug? A. Epinephrine. B. Norepinephrine. C. Dopamine. D. Atropine. Answer, A. In a cardiac arrest situation, the main drug used to stimulate the heart is epinephrine. The others are less often used in a cardiac arrest. 47. Which of the following is not a direct vasodilator? A. Nitroglycerin. B. Sodium nitroprusside. C. Nifedipine. D. Hydralazine. Answer, C. Nifedipine is a calcium channel blocker used for dysrhythmias and hypotension, but it is not a direct vasodilator. The other medications are direct vasodilators. 48. Which of the following is not a calcium channel blocker? A. Verapamil. B. Diltiazem. C. Nifedipine. D. Hydrochlorothiazide. Answer, D. Verapamil, diltiazem, and nifedipine are all calcium channel blockers. Hydrochlorothiazide is a thiazide diuretic and all work to correct hypertension, among other things. 49 beta-adrenergic blockers are contraindicated in what patient situations? Check all that apply. A. Urinary retention. Heart failure. Retention. D. Bradycardia. Asthma. Answer, S, B, D, E. Beta-adrenergic blockers are relatively contraindicated in asthma, bradycardia, and heart failure. They are used to treat hypertension. 50. When giving sublingual nitroglycerin for chest pain, be alert for the following: A. Hypotension, B. Dry mouth, C. Diarrhea, D. Bradycardia. Answer, A. Hypotension, dizziness, fainting, nausea and vomiting can occur when giving sublingual nitroglycerin. It should be given with a moist mouth but does not cause dry mouth. It does not cause bradycardia and can, in fact, cause reflex tachycardia due to hypotension. 51. A patient presents to the ED in acute pulmonary edema. The respirations are 28 and the BP is 140/90. What is the first medication you would likely give the patient? A. Lasix 40 mg orally, B. Lasix 40 mg 4C spironolactone 100 mg orally. D. Mannitol infusion 2G/kg4 infused over 30 to 60 minutes. Answer, B. The most likely choice for acute pulmonary edema is Lasix 40 mg 4. Oral dosage would take too long and mannitol is not indicated for acute pulmonary edema. 52. A patient with chest pain is hooked up to a cardiac monitor. Initially, premature ventricular contractions occur that fall on the T wave of the preceding beat. There is a sudden change to a rhythm with no P waves, no QRS complexes and a coarse, irregular line follows. What does the nurse interpret this to be? A. Lead failure, B. Atrial fibrillation, C. Azystole, D. Ventricular fibrillation. Answer, the patient is having PVCs which has led to ventricular fibrillation. Azystole generally has fine or no variability in the waveform and the patient unlikely has failure of the leads because he has had PVCs which often lead to ventricular fibrillation. 53. A 72-year-old ED patient is complaining of chest pain. He says it has been occurring at the same time every day for the last 2 weeks and occurs at rest without any noticeable precipitating factors. It is not relieved by antacids. What does this chest pain likely represent? A. Variant angina. B. Unstable angina. C. Stable angina. D. Heartburn. Answer, A. Chest pain that occurs around the same time every day and usually occurs at rest is likely variant angina until proven otherwise. Stable angina comes on at rest and unstable angina would not last 2 weeks nor would it have the scenario the patient describes. Heartburn is a possibility but it should be considered variant angina until proven otherwise. 54. A patient has just had an emergency paracentesis for cardiac tamponade. Which of the following should indicate a successful procedure? Check all that apply. A. Patient expressing relief. B. Clear heart sounds. C. Rising central venous pressure. D. Rising blood pressure. E. Falling central venous pressure. Answer, S. A, B, D, E. A successful cardiac paracentesis includes a fall in central venous pressure, a rise in blood pressure, clear heart sounds and an expressed relief on the part of the patient. 55. An EKG strip shows a pulse rate of 120 beats per minute, a PR interval of 0.14, and a QRS complex of 0.08. The rhythm is regular. What is the EKG strip showing? A. Normal sinus rhythm. B. Sinus dysrhythmia. C. Prolonged QT interval. D. Sinus tachycardia. Answer, D. The patient has a regular but fast rhythm of 120 beats per minute, indicating sinus tachycardia. The PR interval and the QRS complex are within the normal range. 56. A patient has just had cardioversion. Which nursing action take, E. Highest priority? A. The patient's level of consciousness. B. The status of the patient's airway. C. The EKG. D. The blood pressure. Answer, B. Following a cardioversion, the adequacy of the airway should be assessed first, followed by the blood pressure, the patient's level of consciousness and the follow-up EKG. 57. The most successful cardioversion would lead to the following outcome. A. Non-arousable, BP 90/50ths. Pulse 90. B. Arousable, BP 100/60. Pulse 40. C. Arousable, BP 114/70. Pulse 72. D. Non-arousable, BP 130/80. Pulse 60. Answer: C. The patient who is arousable following cardioversion with normal vital signs indicates the most successful cardioversion. Patients who are unable to be aroused or who have abnormal vital signs have had a less successful outcome. 58. A patient arrives to the ED and goes into ventricular fibrillation. The monophasic defibrillator should be set at what level in joules for the first defibrillation? A. 50 J. 200. C. 300 J. D. 360 J. Answer: D. A monophasic defibrillator for ventricular defibrillation is always set at 360 joules. 59. A nurse is set to defibrillate a patient who is in ventricular fibrillation. Just prior to discharging the defibrillator, which of the following should be done? A. Set the defibrillator to synchronize mode. B. Verify that the patient is in ventricular fibrillation. C. Obtain vital signs. D. Intubate the patient. Answer: B. The patient in ventricular fibrillation will not discharge the defibrillator in synchronize mode. Verify the rhythm prior to discharging the defibrillator. Intubation and the taking of vital signs only wastes valuable time for the patient in ventricular fibrillation. 60. The patient is in atrial fibrillation with a heart rate of 150 beats per minute. What will the nurse watch out for? A. Hypertension and headache. B. Hypotension and dizziness. C. Sudden onset of bradycardia. D. Nausea and vomiting. Answers: B. With a ventricular rate of 150 beats per minute, there is the possibility of resultant hypotension and physical symptoms of dizziness. 61. The patient is having recurrent episodes of ventricular tachycardia. Which should be of primary concern? A. Causative factors, including caffeine intake. B. The rhythm could deteriorate into VFib at any time. C. The patient will feel very uncomfortable during these episodes. D. The patient's vital signs. Answer: B. The finding of recurrent VTach is worrisome as it can deteriorate into ventricular fibrillation at any time. It is less important to understand the causative factors, the patient's level of discomfort and the patient's vital signs. 62. The patient is on a cardiac monitor and the alarm goes off. The tracing is flat. What is the first thing the nurse should do? A. Call a code blue. B. Turn off the machine and turn it back on again. C. Prepare the defibrillator. D. Check the patient's status and leads. Answer: C. As the tracing could be flat because the leads are off, it is a quick thing to check the leads and the status of the patient before jumping to conclusions that the patient needs a code blue or a defibrillator. Turning the machine off and turning it back on again is not a priority. 63. A patient in the ED is being evaluated for heart failure. He suddenly develops dyspnea, the coughing of pink sputum, tachycardia and mild hypotension. What will the nurse do next after contacting the ED physician? Check all that apply. A. Administer oxygen. B. Administer Lasix/4. C. Increase the 4 drip. D. Administer morphine by 4. E. Place the patient in a side-lying position. Answer: S. A. B. D. The patient should be placed in a semi-Fowler's position, oxygen, Lasix, and morphine delivered. As the patient is already in heart failure, administering extra fluid by 4 is contraindicated. 64. A patient in the ED complains of dizziness. He has a heart rate of 46 and a blood pressure of 80/50ths. What should the ED nurse prepare for? A. Defibrillation. B. Prolonged patient monitoring with the patient in the upright position. C. Transcutaneous pacing. D. Administering 4-digoxin. Answer: C. The patient with unstable bradycardia is a candidate for transcutaneous pacing. 4. Digoxin will further slow the heart rate and defibrillation is not indicated. As this patient is unstable, monitoring further is not indicated. 65. A patient with a known abdominal aortic aneurysm presents with back pain and hypotension. Which of the following interventions should happen? List all that apply. A. Alert the or staff for an emergency surgery. B. Stay with the patient. C. Give 1000 cc for bolus. D. Monitor the patient's vital signs. E. Sit the patient upright. Answer: S. A, B, D. The patient likely has a ruptured aortic aneurysm. As a nurse, you should stay with the patient and alert the or staff for emergency surgery. Do not give 4 fluids unless ordered. The patient should lie on his or her back or be in the Trendelenburg position. 66. The patient is in the ED with a hypertensive crisis. What should the nurse do in the way of intervention? List all that apply. A. Give a fluid bolus. B. Give an antihypertensive agent. C. Monitor vital sign every 5 minutes. D. Have resuscitation cart handy. E. Prepare for defibrillation. Answer: S, B, C, D. A hypertensive crisis is an emergency situation. Prepare for the possibility of a resuscitation by having the resuscitation cart handy, monitor vitals at least every 5 minutes and give an antihypertensive medication per doctor's orders. 67. A patient with a swollen, painful calf suddenly develops dyspnea. What has likely happened? A. The patient has developed a pulmonary embolism. B. The patient is having an acute myocardial infarction. C. The patient is developing a deep vein thrombosis. D. The patient is having a hypertensive crisis. Answer: A. The patient likely has a deep vein thrombosis that has dislodged and has traveled to the pulmonary vessels to form a pulmonary embolism. This is a medical emergency that can lead to sudden death. 68. Thrombophlebitis represents A. A thrombus without inflammation. B. An embolism without inflammation. C. An embolism with inflammation. D. A thrombus with inflammation. Answer: D. Thrombophlebitis is a thrombus with inflammation. 69. An ED patient is found to have an elevated central venous pressure. What are the possible causes of this? A. Increased water retention. Attention. C. Anemia. D. Acute hemorrhage. Answer: A. An increased CVP is caused by increased water retention, heart failure, or kidney failure. It is not caused by hypotension, acute hemorrhage, or anemia. 70. Cardiogenic shock presents itself with A. Hypertension. B. Bradycardia. C. Increased urine output. D. Cold, clammy skin. Answer: D. Cardiogenic shock presents itself with hypotension, cold, clammy skin, decreased urine output and tachycardia. 71. A patient presents to the ED with supraventricular tachycardia and a low normal blood pressure. What is the first thing you can do to relieve this? A. Unsynchronized cardioversion. B. Carotid artery massage. C. Lidocaine bolus. D. Epinephrine bolus. Answer: C. In a stable patient with supraventricular tachycardia, carotid artery massage would be a good first step. If cardioversion is required, it should be synchronized. Lidocaine and epinephrine are not indicated. 72. Typical cardiac markers for acute MI include A. Troponin I. B. SGPT. C. CKMB. D. Bilirubin. E. Immunoglobulin. Answer: S. A, C. Both troponin I and CKMB are markers for an acute MI. 73. A patient is diagnosed with influenza and started on antiviral medication. What do you tell the patient upon discharge? Select all that apply. A. You are now not contagious for the influenza virus. B. Take the medications until you begin to feel better. C. You are not at risk for bacterial superinfections. D. You are infectious for up to 2 days after starting antiviral medication. E. Call your doctor if you have side effects from taking the medication. Answer: S. D. E. The medication must be taken until it is gone and you are contagious for up to 2 days after starting the antiviral medication. there is still a risk of bacterial superinfections. There are side effects from these medications that must be reported to the patient's physician. 74. An ED patient is prescribed theophylline upon discharge from the ED for asthma. What will you tell the patient about taking the medication? A. The medication must be taken at night. B. Do not eat chocolate, drink coffee, or drink cola on this medication. C. Do not take along with a beta agonist medication. D. Do not take this medicine with beta blockers. Answer: B. Patients on theophylline should avoid xanthine-containing food items including coffee, chocolate and cola. 75. A patient with asthma is discharged on a beta agonist inhaler and a corticosteroid inhaler. How do you instruct the patient to take the medications? A. Take the beta agonist inhaler first and then the corticosteroid inhaler. B. Do not take the two inhalers together. C. Take the inhalers both in the evening. D. Take the corticosteroid inhaler first, rinse your mouth and take the beta agonist next. Answer: A. The patient should take the beta agonist inhaler first to open up the airways that will then be more able to absorb the corticosteroid inhaler. They can be taken together at any time during the day or night. 76. The ED patient is given IM Benadryl for an acute case of hives. What do you tell the patient upon discharge? Select all that apply. A. Do not drink alcohol for the next few hours. B. Do not drive yourself home because Benadryl can be sedating. C. Do not sleep for 8 hours. D. Do not take corticosteroids with this medication. E. Oral medication can be taken at home if the itching recurs. Answer: S. A. B. E. The patient receiving high doses of Benadryl should not drive themselves home because of the sedative effect of Benadryl and should not drink alcohol. Oral medication is available if the patient has recurrent symptoms. The patient can sleep if desired and can take corticosteroids concurrent with taking Benadryl. 77. A patient prescribed terbutaline for asthma should be cautioned if they have which of the following underlying conditions? A. Hypothyroidism. B. Diabetes mellitus. C. Liver dysfunction. D. COPD. Answer: B. Terbutaline can raise blood sugars, so it should be used with caution in patients who have diabetes mellitus. 78. The nurse is treating a patient with naloxone for an intravenous opioid overdose. The following equipment should be nearby. A. Paracentesis tray. B. Lumbar puncture tray. C. Foley catheter tray. D. Resuscitation equipment. Answer: D. As the patient is suffering from an intravenous opioid overdose, the nurse should have resuscitation equipment standing by. 79. The patient is being discharged on a cough suppressant, which is not a prescription cough suppressant. A. Tesalin. B. Robitussin. A. C. Robitussin. D. M. Codeine sulfate. Answer: C. All but Robitussin DM are prescription cough suppressants. 80. The patient is recommended an inhaled nasal decongestant. What information should you share with the patient? A. They should not be taken with intranasal corticosteroids. B. They should not be taken for more than 48 hours. C. They do not cause rebound nasal congestion. D. They cannot be used with Robitussin products. Answer: B. They should not be used for more than 48 hours because of a risk of rebound nasal congestion. They can be used with intranasal corticosteroids and Robitussin products. 81. Patients prescribed ipratropium for asthma should not take the medication if they have what condition? A. Diabetes mellitus. B. Peanut allergy. C. Coronary artery disease. D. Liver dysfunction. Answer: B. Ipratropium is made from a plant substance that is similar to peanuts, so cross allergies can occur if the patient has a peanut allergy. 82. Infectious disease/respiratory precautions should be taken if a patient is suspected to have all but the following: A. Influenza. B. Tuberculosis. C. Pulmonary embolism. D. Ebola. Answer: C. Of those listed, only pulmonary embolism is not considered contagious while the others are contagious. 83. A 65-year-old male with a history of COPD presents with an exacerbation. Which of the following represent the likely presentation? List all that apply. A. Open mouth breathing. I.EAD rapid respiratory rate. E. Bradycardia. Answer: B. D. With COPD exacerbation, there is rapid heart rate, increased respiratory rate, pursed lip breathing, hypoxia, and hypercapnia. 84. A patient with COPD requires a precise amount of oxygen to be given. What kind of oxygen delivery system should he have? A. Nasal cannula. B. Face mask. C. Venturi mask. D. Tracheostomy. Answer: C. Only the Venturi mask can deliver a precise amount of oxygen and is suitable for those with COPD. 85. A patient has sustained a multiple trauma and is at risk for acute respiratory distress syndrome. Which is the earliest sign of this condition? A. Increased respiratory rate. B. Rhonchi on inspiration. C. Use of accessory muscles to breathe. D. Wheezing on expiration. Answer: A. The earliest sign of acute respiratory distress syndrome is an increase in respiratory rate. The other symptoms may come on later. 86. A person who has been intubated following a car accident has the high pressure alarm go off on the ventilator and absent right upper breath sounds. Which should be suspected first? A. Pulmonary embolism. B. Pneumothorax. C. Misplaced endotracheal tube. D. Acute respiratory distress syndrome. Answer: B. The patient has a high likelihood of having a pneumothorax. If the endotracheal tube was displaced, it would normally result in an absence of breath sounds on the left rather than the right. A pulmonary embolism is unlikely and acute respiratory distress syndrome would have different symptoms. 87. A patient has just been diagnosed with a flail chest. Which characteristic finding would the nurse notice? A. Dyspnea. B. Paradoxical chest movements. C. Cyanosis. D. Hypotension. Answer: B. Paradoxical chest movements are characteristic of a flail chest while the other symptoms can be due to a variety of lung conditions and are not classic findings in flail chest. 88. A patient is suspected to have a pneumothorax based on the following findings. A. Decreased heart rate. B. Fast deep respirations. C. Wheezing on expiration. D. Absent breath sounds on one side of the body. Answer: D. The most characteristic finding in a pneumothorax is absent breath sounds on one side of the chest. 89. A trauma patient with a puncture wound to the chest wall covered with an occlusive dressing complains of increasing air hunger and is suffering from hypoxia. The trachea is deviated. What should the nurse first do? A. Increase the oxygen. B. Use an ambu bag to ventilate. C. Remove the dressing on the puncture wound. D. Perform an emergency tracheostomy. Answer: C. The patient likely has a tension pneumothorax. By removing the dressing, the tension is removed and the patient's tension pneumothorax will revert to a simple pneumothorax. 90. When a pulmonary embolism is suspected, the nurse should do the following. Check all that apply. A. Lower the head of the bed. B. Administer oxygen. C. Notify the ED staff and the rapid response team. D. Prepare the patient for an arterial blood gas. E. Ensure that N4 is ready for heparin infusion. Answer: S. B, C, D, E. All of the above should be done except that the head of the bed should be elevated. 91. A COPD patient is in the ED for pneumonia. He is hypoxic with hypercapnia. What should the oxygenation of the patient be? A. 100% oxygen by mask. B. 1 to 2 1/min oxygen by nasal cannula. C. 4 1/minute oxygen by nasal cannula. D. 4 1/minute oxygen by mask. Answer: B. A COPD patient who is already hypoxic uses the hypoxia as a drive to breathe. If you give them too much oxygen, there will be a decrease in the drive to breathe and respiratory failure. 92. As a nurse, you are asked to give a patient Zofran, ondansetron. For what purpose are you giving the medication? A. Nausea and vomiting. B. Paralytic ileus. C. Intestinal obstruction. D. Urinary retention. Answer: azofran, ondansetron, is indicated for nausea and vomiting. 93. As a nurse, you are asked to give the patient Imodium, loperamide. For what purpose are you giving the medication? A. Urinary retention. B. Diarrhea. C. Constipation. D. Gastrointestinal bleeding. Answer: B. Imodium, loperamide, I given for the management of diarrhea. 94. A patient presents to the ED with what is diagnosed a hepatic coma. What medication will you expect will be given? A. Imodium. B. Ammonium sulfate. C. Lactulose. D. Zofran. Answer: C. Hepatic coma results from elevated ammonia levels for which the treatment is lactulose that allows for the elimination of ammonia through the stool by increasing peristalsis. 95. A patient presents to the ED with a stomal prolapse from an ileostomy. What does the nurse notice? A. A sunken stoma. B. A protruding, erythematous stoma. C. A flattened stoma. D. A bluish discoloration of the stoma. Answer: B. When a patient has a prolapsing stoma, it is protruding from the abdomen and is erythematous and edematous. 96. A cirrhosis patient has the finding of asterixis. How would the nurse elicit this finding? A. Have the patient lean over while sitting. B. Ask the patient to lie down and lift one leg. C. Have the patient protrude his tongue. D. Ask the patient to extend the arms. Answer: D. The patient with asterixis will have flapping of the hands when extending the arms as a finding of cirrhosis. 97. A patient presents to the ED with a suspected perforated gastric ulcer. What is the most common finding? A. A rigid abdomen. B. Tachyarrhythmias. C. Diarrhea. D. Leg numbness. Answer: A. The most common finding of a perforated gastric ulcer is a rigid abdomen because of peritonitis. The other findings are not typical of a perforated gastric ulcer. 98. A patient with hepatitis has been found to have it because of eating contaminated food. What is the most likely type of hepatitis the patient has? A. Hepatitis A titis. B. C. Hepatitis C. D. Hepatitis D. Answer: A. Of the different types of hepatitis, only hepatitis A is transmitted through contaminated food or water. 99. A patient has just been diagnosed with GERD, gastroesophageal reflux disease. What foods should the nurse tell the patient to avoid? Check all that apply. A. Peppermint. B. Coffee. C. Non-fat milk. D. Chocolate. E. Baked chicken. F. Fried chicken. Answer: S. A, B, D, F. The patient should avoid peppermint, coffee, chocolate, and fried foods. The other foods shouldn't precipitate GERD. 100. A patient has just been diagnosed with hepatitis A. What should the nurse expect as a finding? A. Black, tarry stools. B. Malaise. C. Left upper quadrant abdominal pain. D. Diarrhea. Answer: B. The most common finding in hepatitis A is malaise. Pain, if present, occurs in the right upper quadrant. Diarrhea and black, tarry stools are not a consistent finding of hepatitis A. 101. A patient is suspected to have acute cholecystitis on the basis of what findings? A. Left lower abdominal pain, radiating to the umbilicus. B. Right lower abdominal pain radiating to the umbilicus. C. Right upper abdominal pain, radiating to the back. D. Right upper abdominal pain, radiating to the right shoulder. Answer: D. The patient with acute cholecystitis will have right upper abdominal pain that radiates to the right shoulder. 102. A patient suspected to have pancreatitis has which of the common pain scenarios? A. Severe, unrelenting pain in the lower abdomen, radiating to the groin. B. Severe unrelenting pain in the upper abdomen, radiating to the back. C. Burning, intermittent pain in the upper abdomen, radiating to both shoulders. D. Burning and aching pain in the right upper quadrant, radiating to the right shoulder. Answer: B. Pain from pancreatitis is usually severe and unrelenting in the upper abdomen, sometimes radiating to the back. 103. A patient has been diagnosed with acute appendicitis and is waiting in the ED to go to surgery. He suddenly vomits and experiences increased pain and distension of the abdomen. What nursing intervention would you do? A. Apply warm compresses to the right lower quadrant of the abdomen. B. Notify the ED physician. C. Give prescribed pain medication by 4. D. Give oral Tylenol with codeine as prescribed. Answer: B. The patient has likely ruptured his or her appendix. The nurse should notify the ED physician and should not give pain medications, orally or by 4. Warm compresses are not indicated in this situation and might make things worse. 104. A patient has severe left lower quadrant abdominal pain, fever, and a rigid abdomen. What is the most likely diagnosis? A. Diverticulosis. B. Appendicitis. C. Sepsis. D. Diverticulitis. Answer: D. The patient with the above symptoms probably has a ruptured diverticulum with peritonitis and probable peritonitis. A 23-year-old patient has developed bloody diarrhea. What is a likely 105 diagnosis? A. Diverticulosis. B. Acute appendicitis. C. Ulcerative colitis. D. Crohn's disease. Answer: C. Ulcerative colitis presents with bloody diarrhea. The other 3 do not present with bloody diarrhea. Crohn's disease usually presents with diarrhea that is not bloody. Conclusion: if you enjoyed this book, would you be kind enough to leave a review on Amazon? Your reviews can help others to see what kinds of helpful resources are out there. I'll talk to you soon and see you in the next book. Thank you and good luck on your medical endeavors. Chase Hassan, Nurse Superhero.